Long before laboratories, blood tests, or clinical trials, humans searched for strength wherever they could find it, in roots, leaves, and the rhythms of nature. In ancient India, one root came to symbolize vitality, endurance, and resilience. It was believed to restore what age, illness, and stress slowly take away. That root was ashwagandha. But today, in an era shaped by evidence and biology, a harder question remains. Does ancient belief survive modern science, or does it collapse under scrutiny? Historical and mythological context. Ashwagandha, scientifically known as Withania somnifera, holds a foundational role in Ayurveda, one of the oldest structured medical systems in human history. Its name roughly translates to the smell and strength of a horse, reflecting two long-standing ideas: physical vitality and reproductive power. In classical Ayurvedic texts, including the Charaka Samhita, ashwagandha was classified as a rasayana, a category reserved for substances believed to promote longevity, strength, and resistance to decline. Traditionally, ashwagandha was associated with aging men experiencing weakness, warriors recovering from exhaustion or injury, individuals weakened by prolonged stress or illness. Importantly, Ayurveda did not frame ashwagandha as a stimulant. It was understood as restorative, not activating, a distinction often lost in modern supplement marketing. Traditional use in practice. For more than 3,000 years, ashwagandha was administered slowly and deliberately. Common preparations included dried root powders, decoctions simmered for extended periods, formulations combined with milk, fats, or honey. These preparations were taken over weeks or months, not days. Traditional use emphasized recovery from exhaustion, support during chronic stress, gradual restoration of strength. This slow timeline matters. It mirrors what modern physiology tells us about stress, hormones, and recovery, systems that do not reset overnight. Transition from belief to biology. Tradition tells us what people observed. Science asks why those observations occurred, or whether they were coincidence. To answer that, we leave ancient texts behind and step into endocrinology, stress physiology, and clinical trials. To understand ashwagandha's effects, we need to talk about stress biology. Chronic stress activates the hypothalamic pituitary adrenal axis, or HPA axis, the system that governs cortisol release. When this system remains active for too long, the body shifts into survival mode. In that state, energy is conserved. Reproductive hormones are suppressed. Libido and recovery decline. Testosterone production can fall. Ashwagandha contains compounds known as withanolides, which appear to influence stress signaling pathways in the brain and adrenal system. Rather than forcing hormone production, ashwagandha may help normalize stress signaling, allowing the body to regain balance over time. This explains why its effects are slow, indirect, and highly dependent on baseline stress. Modern science, mechanisms, and evidence. Stress, cortisol, and the nervous system. In modern research, ashwagandha is classified as an adaptogen, a substance that may help the body regulate its response to stress. Multiple studies suggest ashwagandha supplementation can reduce cortisol levels, the body's primary stress hormone. Chronically elevated cortisol is associated with fatigue and burnout, reduced libido, suppressed testosterone, impaired sleep, mood disturbances. Reducing stress alone can indirectly influence energy, sexual health, and perceived vitality, without directly stimulating hormones. Testosterone, fertility, and sexual health. Some clinical trials, particularly in men experiencing infertility or chronic stress, show modest increases in testosterone levels and improvements in sperm concentration and motility. A critical clarification: these effects are small and not consistent across all populations. Furthermore, strongly dependent on baseline stress and overall health. Ashwagandha does not act like testosterone replacement therapy or performance-enhancing drugs. Its influence appears secondary, not primary. Physical performance and recovery. A limited number of studies suggest improvements in strength, muscle recovery, and endurance in certain groups, particularly when combined with resistance training. However, results vary significantly with study designs, and the extracts and doses are inconsistent. This remains an area of interest, not a final conclusion. Who may benefit and who may not? Not everyone responds to ashwagandha in the same way. Clinical evidence suggests potential benefits are more likely in men under chronic psychological stress, individuals with stress-related fatigue, men with infertility linked to oxidative stress. In contrast, healthy individuals with normal hormone levels often show little to no measurable change. This matters. Ashwagandha does not elevate the body beyond its natural range. It may help restore balance, but it does not create super-physiological effects. This distinction separates evidence-based use from supplement hype. Limitations, safety, and reality check. This is where evidence-based credibility matters most. Ashwagandha is not a cure, and it is not hormone therapy or replacement to hormone therapies. Besides, ashwagandha is not effective for everyone. Key limitations include wide variability between commercial extracts, inconsistent dosing across studies, and limited long-term safety data. Potential interactions have been reported with thyroid medications, sedatives, immunosuppressive therapies. This is not a case of natural equals safe. It is context-dependent biology. Ashwagandha survived history not because it was magical, but because stress, exhaustion, and decline have always followed humanity. Modern science does not validate ancient belief outright, but in some cases, it explains why those beliefs endured. The truth lives between tradition and biology, not in hype and not in dismissal. Subscribe for evidence-based herbal science, where ancient tradition meets modern research. Tradition offers history, but science demands proof. These references represent what modern research confirms, questions, and continues to explore. This video is provided for educational and informational purposes only. It is not intended to provide medical advice, diagnosis, treatment, or cure for any disease or medical condition. The discussion of ashwagandha, Withania somnifera, in this video includes historical context, traditional use, and summaries of current scientific research based on publicly available peer-reviewed literature and authoritative sources. Historical or traditional practices are presented for cultural and educational context only and should not be interpreted as proven medical treatments. Scientific studies referenced may have limitations, including small sample sizes, variability in study design, differences in extract preparation, dosage, duration, and participant characteristics. Individual responses to herbal products can vary significantly based on health status, genetics, medications, and other factors. Herbal supplements are not regulated or evaluated by the U.S. Food and Drug Administration, FDA, in the same manner as prescription medications. Products marketed as supplements may differ in quality, composition, and potency, and may carry risks or interactions. Ashwagandha may interact with certain medications, including but not limited to thyroid medications, sedatives, immunosuppressive agents, and other drugs affecting the nervous or endocrine systems. It may not be appropriate for all individuals, including those with specific medical conditions, those who are pregnant or breastfeeding, or those taking prescription medications. Viewers should not substitute this information for professional medical advice. Always consult a qualified healthcare professional, such as a physician or pharmacist, before starting, stopping, or changing any supplement, medication, or health-related practice. No supplement brands are endorsed, promoted, or sold in this content. No outcomes or benefits are guaranteed. This video does not encourage self-diagnosis or self-treatment. By viewing this content, you acknowledge that the creator is not responsible for individual health decisions made based on this information.